talk a little bit about how to plan your skincare. I mean, for those of us as we age, most people sort of have an idea, or they know a few buzzwords like microdermabrasion, or everyone knows facials, but you probably don't really know how they all interact with one another, and if you do one, is it necessary to do something else? So I've drawn a little bit of a homemade diagram here, a very, very simplified form of what your skin sort of looks like. So we've got the topmost layers, and this is your epidermis. You've got the deep skin, what they always call your deeper skin, which is this bit, the dermis, and the deeper, what sits underneath that. This is where all your collagen and your elastin and everything else in. When you put a regular moisturizer on, most moisturizers tend to be oil-based, and the molecule size is actually quite important. They mostly tend to sit on top of the skin, so you could have a situation where something like oil of Olay perhaps, or Vaseline or something oily would sit on top and not really penetrate. A slightly better, whereas something like a serum would actually go in quite deep. As to how deep it goes, it really depends on what you use, the molecular size, and how much money has been spent on the research to deliver the product to the right space. So this is a little bit about products, and you want to make sure that you're paying for the science that goes behind the research and not too much for the advertising or the media hype around a product. In terms of treatments, you've got a few options. So when you start to think about your skin as, if you just think of it as having these three distinct layers, and you're trying to target each and every one of it, that's when it sort of gives you that really, really good result. So if you think about your epidermis, which is the topmost layer, this is where all the shedding happens and everything else. And within this layer, this is where treatments like your microdermabrasion and a chemical peel comes in. So this is where microdermabrasion and peels really make a difference. My personal preference is for peels. Sounds scarier, but the reason it's so nice is that it actually takes away quite an even layer of the skin on top, and it's mostly dead skin, allowing the skin underneath to regenerate a lot better. The next layer of the skin for us to think about is the deep skin, what's referred to as the deep skin, which is the dermis, and this is where the facials come in, and especially if you have a really good quality medical level facial. Now the difference between a regular medical facial and a normal facial is frankly in the products used and the delivery mechanism of how deep it's able to reach, because the deeper the product reaches, the more it can do. So in this area, it's medifacials. And then we come to this layer, the subcutaneous tissue, and this is, a lot of people consider this to be the hardest layer. This is where all the collagen is and everything else is. This is where the plumping of the skin occurs, and this is where, if you think about it, it's sort of a little bit like a scaffolding underneath, which will push everything back up. And so it's wonderful. This is the real area we want to focus on. And what are the modalities here? So there are a few modalities that we offer here. One of the commonest one is microneedling. Now, if you think about microneedling, you've got a scenario where you have a needle that can go in to pretty much any depth from 0.3 millimeters all the way to 3 millimeters. So with 3 millimeters, you can imagine how deep it goes in. So for someone with acne scarring or pitted scars, or really deep wrinkle, we can actually target it so that it goes in much deeper compared to another part of the skin. So you can literally adjust the level of the needle so that sometimes it's going all the way in, other times perhaps it's only going to the top and giving you a peel-like effect. And it's quite a bespoke treatment. It's quite nice when you're in the hands of someone who knows how to adjust it to different parts of your skin according to what your skin needs. And once we create these little micro holes, there's two things that can happen here. The first of all is that we would put a very good quality serum into it. So right now you have the benefits of a serum that normally cannot penetrate so deep, going all the way in. You've also got the option of combining this with something called radiofrequency, where once the needle is in, it will actually shoot energy out. Now, this procedure is called radiofrequency microneedling, and the nice thing about it is that it produces a controlled damage at this level, causes collagen bundling, and you will get the results up to 9 months. With the microneedling procedures, as it suggests, there will be needles involved and there will be a little bit of pain, and most people don't really like this. However, there is a place for it, and it is absolutely wonderful in terms of results. But for those who don't like pain, there is one other option which is absolutely wonderful. not only because of the treatment results, but also because of the fact that you don't have to worry about the sun. There is no downtime. You generally go out with a better face than when you came in. And this is radio frequency alone. So we call it the non-surgical facelift because what it does is that it causes skin tightening to happen. It can be used on any part of the body. So the common areas we do tends to be the face and jawline. Neck and décolletage, absolutely wonderful results. You can even do it on your arms, your belly, any part of your body where there's crepey skin that you feel can do with a little bit of tightening. Results generally tend to keep improving after about 3 months. And so it's one of those things where if you could plan to do it 2 or 3 times a year, you will find that it gives you very, very long-standing results and is one of the better ways, especially for those who are not interested in the Botox and fillers of the world.